Have you been mindful today? Are you aware of your current mental health state? These are the messages we're constantly bombarded with on social media and ads. And I'm here to tell you why mental health awareness can actually be harmful. Some mental health awareness campaigns have had positive benefits. They reached a lot of people. For example, hashtag #MyTipsForMentalHealth on Twitter trended with 30,000 posts, according to a study published in the National Library of Medicine study. And Instagram's #HereForYou campaign connected people to crisis text lines and online communities. But there's a bigger issues that need to be addressed here that mental health awareness campaigns aren't addressing. What we fail to recognize about increased awareness is that increased awareness of mental health doesn't mean increased access to mental health resources. A lot of times these campaigns use language like reach out if you need help or call this number if you're struggling. But when you use that language, it's indicative of a larger neoliberal outlook that America has on healthcare in general, that it's the individual's responsibility. As an individual responsibility is a dangerous route because it negates the fact that we're affected directly by the systems we live in. Things like poverty and systemic oppression have a great effect on mental health. Colette Shade, a therapist, found in a study from 2019 that in counties where automotive plants closed, opioid overdose rates rose by 85% after 5 years. That's not to mention that most people in our country are placed a huge financial burden upon if they try to seek out mental health care. It means hundreds of dollars each session for a psychiatrist without insurance, or $30 to $50 per week, which adds up even if you have copay insurance. Mental health care is a privilege only some can afford, and these awareness campaigns tell people just to reach out if they need help. Some people can't reach out even if they knew they needed help. Another dangerous side effect of increased mental health awareness is when that awareness becomes hyper-awareness. And one example in particular that I'm talking about here is the percentage of U.S. children that have received a diagnosis of ADHD. Now, the National Library of Medicine cites 6.4 million children across the U.S. have received a diagnosis of ADHD at some point in their lives, which is 11% population. 2/3 of these children are medicated. That's a lot of kids on medication for ADHD. And the National Library has that at a 41% increase in the last decade. Now, there's some dangerous side effects to being medicated for ADHD, such as the risk of medication, plus the financial burden on the parent and family, and the stigma of being mentally ill. So maybe that's not necessarily the right path for every kid, is to be medicated, but we're pushing a larger narrative of if you are aware of your child's mental health, then any good parent would get them diagnosed and medicated for ADHD, when maybe that's not the right solution for everybody, and we need to critically examine that. It's also obvious that the internet plays a huge role in mental health awareness, but sometimes this leads people astray. Right here you can see the Pew Research Center has 28% of internet users who look online for symptoms about depression, anxiety, stress, or mental health. And that leads to some people misdiagnosing themselves, incorrect conclusions drawn by non-professionals, especially a trend in adolescents on TikTok and sites like that, where they relate to content users' post about their mental illness and immediately assume that they have a mental illness and end up experiencing some of the side effects by themselves. And something called the Munchausen effect, which you can read about in one of the later links, but we're experiencing more symptoms of mental illness because we're more aware and so hyper-focused on mental illness. Look, what we can see now is mental health awareness just simply isn't enough. We need to do more. We need to acknowledge the outside factors and focus on a community-based approach for mental health versus that individual approach that we see so much of today. We need to keep social issues in mind when we're talking about mental health. We need to bring that into the conversation that we're having now. And most of all, we all need to demand universal health care so everybody can receive the long-term solutions to mental health that they deserve.